Good morning, and thank you for joining our Crittenden Medical Liability Conference virtual event. My name is Michelle Weinberg, and I'm the editorial director for Crittenden Research. We're thrilled to have you here this morning to hear from two of our industry experts who will share valuable insights on artificial intelligence in healthcare. Last fall, we did send out a survey to conference attendees, which some of you may have gotten, and with a list of the topics to rate by interest. And artificial intelligence and technology were two of the highest rated. And if you've seen the agenda for our annual 2.5-day Crittenden Medical Conference live event, April 8th through 10th, which is going to be held in Charleston, South Carolina, you've seen several panel topics that will touch on these two hot topics in various ways. And you can see that agenda by visiting crittendenmedical.com. During this virtual event, our panelists will discuss the use of AI in administrative processes, managing bias, the risks, and how AI is currently being regulated in healthcare. Just two small housekeeping items before we get started. We will be leaving time for questions before the session ends, so please, at any time during this, you can leave your questions in the chat box. And we will also are recording this virtual event, and that recording will be mailed to you after this virtual event. Now I'd like to introduce you to our panelists. Let me bring them on. Jennifer Schoenthal is the head of digital health for Hudson Pro, the financial and professional lines of Hudson Insurance Group. Recently, Jennifer developed and launched Hudson Pro's new digital health modular product offering, which includes medical professional liability, cyber, and technology errors and omissions. Jennifer does have over 25 years of experience in underwriting and product development and is a nationally recognized speaker and writer. Linda Jones is the managing director and healthcare leader at Marsh with over 30 years of healthcare and insurance industry experience. She brings a unique risk management approach to serving her clients, and she's worked with healthcare organizations throughout the country, including health systems, outpatient facilities, and large physician supergroups. Thank you, Jennifer and Linda, for joining today.
Thank you.
Thanks for having us.
And I'm going to share my screen here. We do have a couple of slides that we also want to go through with the presentation that we have. Sorry, everything is being quick to the next here.
You blame it all on AT&T, right?
I am. 1 second, it's moving ahead. Oh my goodness. 1 minute here, guys. All right, well, I'm just going to move along until we get to this slide. So you've likely seen the headlines, the headlines over the years and more recently, and so too, of course, in the general public, seen the headlines. AI and robotics is transforming healthcare. There's a new headline every day. One actually this morning that said, how AI is transforming and saving lives. Noting how AI in healthcare, it's an absolute game changer, from robotics-assisted surgery and connected devices to identifying complex illnesses at an earlier stage. Then there's the AI-powered diagnostics that leverage machine learning algorithms to analyze diverse data like medical records and scans. And in 5 years, the AI healthcare market is expected to grow from $20 billion this year to $148.4 billion by 2029. But a recent survey of U.S. health system leaders, only 16% reported having system-wide policies for AI usage and data access. So this is showing the roadblock in the healthcare system that they're running up against, and also how the healthcare industry has historically lagged behind other fields in adopting new technologies. However, healthcare is craving change, and AI's potential is vast. There's obviously a lot of literature around healthcare and AI. A lot of that is tech heavy. So with sharing, there was a book I was going to share, but clearly skipped ahead to the slides. Like I said, we're sharing the slides after this. So, but I'm going to stop sharing my screen here a minute while we're talking so that I can fix this. But the book is called AI 2041, if you guys have heard or seen of it. It was a book that Jennifer has read. She's also suggested it, but kind of just makes easy to digest reading, where AI can obviously be very tech heavy. Next thing we're going to do is go into the, let me get to the slide so I can share again. The generations of artificial intelligence, which I'm going to ask Jennifer to kind of walk us through.
Perfect.
This. Thank you.
That's the slide. We're back in business.
Hey, all right.
Yeah, so I thought it was important that we maybe talk about where we are with AI. AI is really still in its infancy. We're actually already utilizing AI 4.0, which I guess we would categorize as generative AI. But even when we look at generative AI, a good portion of it is actually being used from AI 3.0, which would be deep learning. So deep learning is it's used to analyze patterns and structures in large data sets, and then they take that to form conclusions where you can learn and create. Generative AI really just does what it says on the box. It generates text, images, or even code based on a prompt or an input. And I think when we all talk about AI that learns, this is what we're referring to. It's generative AI in nature. But I don't think we're going to stop here. I'm fairly certain that we'll be seeing AI 4.0, 5.0, and far into the future.
And in humans versus AI, what are the strengths and weaknesses? Do either of you have any examples to share?
Sure, yeah. So I think when we talk about AI, our minds automatically jump to computers are going to replace us. But in actuality, AI isn't good at everything. And it's definitely not good at everything that humans are. AI to me is a tool. It's not a replacement for a clinician or an insurance professional. We're facing huge clinician shortages and clinician burnout, and we have to find ways to sort of fight this. It's really the same in the insurance industry. We have personnel shortages, and we have no ways to fill those gaps. We're not replicating professionals in either field as quickly as we need to. So I really think that instead of villainizing AI, we need to look at it as something that can make our jobs easier, more efficient, and more cost effective. AI shouldn't be implemented with the goal that it's going to replace people. It should be looked at as a pen, a pro wada wheel, really stuff that's going to make our lives easier and help prevent burnout. I actually just looked at a risk that was a telehealth company, but they were using AI to do the medical diagnosis. So you would do a series of questions with an AI chatbot, and at the end, it would diagnose you. I made up some ailments and talked with the AI chatbot for a while, and at the end, it said that, and it was very unceremonious. It just came up on the screen and said, "There's a high probability that you may have a form of cancer. You should seek medical attention." That was it. So, I think when we're looking up here at the things that humans are good at and the things that AI is good at, it was able to recognize patterns. It did well at information processing, but when we look at empathy, judgment, it really lacked there. And that's why I don't think that we need to worry about AI taking everybody's jobs. Instead, it would be the clinician uses AI to come up with the diagnosis, but then the clinician has the human interaction with the patient at the end.
Mm-hmm.
Yeah.
And then, oh, sorry, go ahead.
I just want to add to that too. So if you look at how, following up what Jennifer said, in looking at AI, people immediately go to it replacing humans or healthcare providers and making diagnoses. And we're going to talk about it a little bit later, just splitting that between the clinical function and the administrative function. And you're going to see significant, there we go, I'm finally seeing the deck. You're going to see, the administrative duties is already going. You talk about the amount of money that's being devoted to AI. I believe Bain Capital said that last year there was over 60 billion, that's B with a billion, dollars that were sent or invested in healthcare AI research and implementation. So it's not going away, but you're right, Jennifer, the empathy lacking. But if you talk about some of the fears that people have, I've always heard that, kind of rumors amongst medical students is don't go into pathology, radiology, or dermatology because they're going to be replaced by AI. But that's not true. They will be co-pilots, which is the term that's really being used a lot as a tool to use, but along with the human aspect of it with care. So whether that's a mold check and that the computer can check that, but there's biases, which we're going to talk about. There's, failures of identifying, but the human portion of that will still be needed.
And then you have generative versus traditional AI. Are there examples here also that you can share?
Sure. So the generative piece is, again, creating language and creating documentation or images or communication from the prompts that are given or from areas that have been identified. Where traditional AI might be large, which might be machine learning, where you're not creating new content, but it may be identifying holes in areas, maybe identifying breaks in treatment, but not creating new content.
And then looking at how AI, ahead on me. Looking at how AI is being used in healthcare today.
Yes.
Can you want to go through this, and then the other part of it, the next slide, is about more with the journey from an implication standpoint.
Sure. So as we talked before about the clinical applications versus the administrative, again, people I think are more focused on the clinical, but the administrative applications are what's really moving fast. Okay. So I know from the clinical aspect, you have, the monitoring, the diagnoses, whether there's robotics involved, predicting, future care. And that, again, that could be having a mole that's identified by a computer. It could be supplemental tools that says, as Jennifer explained, you put in the various areas, and this has already been happening, of clinical symptoms, and they come up with a potential diagnosis. And I've worked with one client that has had that in place, and it identified the actual diagnoses where the humans were missing it, but it kind of gave another prompt, have you considered this? So, but the administrative piece, which was really exciting, and we're seeing really, the goal is smaller, faster, better, quicker, where you're having implementation from an administrative area to make the jobs more efficient and really faster and less reliant on humans to do. So whether that's in finance, I've been heard about a hospital that had a tool through AI that will review the documentation, and it'll come up with CPT codes and ICD-10 codes. And so they still need to verify that because there's tremendous liability from a false billing process if you're not, but they said it's fairly accurate. There's tools in place for credentialing. When you're seeing that a physician may have some holes in their credentialing checklist, or their renewal credentialing process or renewal privileges, it'll identify where those holes are, create the letters, go out to their, for instance, getting their DEA license or whatever that is, to have that communication process where that has always been manual in the past. Other areas are using telephones and calling and triaging patients and making sure that based on what they're hearing, what the system is hearing, it gets the patient to the right place. So again, some of these administrative processes are really happening, and they're happening fast, whether that's financing, documentation, those areas, again, part of that $60 billion worth of investment are happening, and tech companies and electronic medical record companies are all implementing those things. One that was really interesting to me was the ambient documentation in the operating room, where it's listening and it's recording and it's creating the documentation of the operative note. So again, the physician still needs to approve it, but you think about that level of privacy or what's happening, because if they've ever been in an operating room, it's not just talking about the patient. So that's an interesting aspect of that. So again, really breaking that up, but we really see the administrative piece really happening significantly faster from an implementation standpoint.
And on the clinical side, I would say that radiology was probably the earliest adopter of AI. And we probably should touch on AI-supported mammography, just because it's showing incredible results in its clinical trials. I think it was back in the late 90s, CAD was developed, which is computer-aided detection, and it was developed to assist in interpreting mammograms. Initially, it was just applied to 2D mammography, and it was just aimed to identify suspicious or potentially suspicious findings. If we fast forward to today, we're now using advanced AI algorithms that will enhance mammography accuracy. The algorithms we're seeing today are highlighting small lesions that could easily escape the human eye due to fatigue, burnout, or other factors. And then the benefits of it would be, improved detection, reduced false positives, earlier detection, and more reliable results. It's particularly effective when combined with 3D mammography in detecting suspicious features in an image. And then it's using predictive algorithms to predict the likelihood of malignancy. And they're using that right now to assist in clinical diagnosis. One of the hospital systems here in Atlanta, where I sit, is actually using AI within their women's health center. And they used it during my last mammogram. So, definitely exciting times, especially for women's health.
And then looking at the risks, Linda, can you talk a little bit about the risks? And then Jennifer, if you can talk a little bit about the bias in AI that we're seeing.
Sure. So there are tremendous risks, as you can imagine. We're going to be focusing on some of them a little bit later as well. But really, they're saying now that it is the number one risk from a board standpoint, from a corporate governance standpoint, of what are we doing about AI? And we see, even on that journey slide that you had previously, we have organizations that are just saying, oh, let's talk about it, to, as Jennifer mentioned, already implementing it in their mammography. And to imagine that they're still using fax machines and they're doing this simultaneously is funny. But it is a tremendous risk. So we're going to be talking about the various patient care risks, the medical malpractice risks are obvious, but there's tech E&O exposure. There's tremendous cyber exposure as well. You think about all the information that they're going to have. There is risk for bias, which we're going to, Jennifer will be speaking more about. But there's insurable risks and those that are just risk from implementation. Another area of risk that I've been told is that it doesn't necessarily translate to other languages. So it's being, written in particular languages, primarily English communication, but that translation doesn't always happen. But now we're even seeing some of the AI video translation services, if anyone's seen that, where you used to have to get translators to translate a podcast or an interview. Well, now they can have the person who's speaking, and that translation will happen through AI with that person's mouth speaking the other language. So that's part of that, the deep fake issue, the concern from that, and whether there's going to be a watermark. But there's that risk for translation in other languages. So again, we're starting in that journey, identifying the areas of exposure. But really looking at now is really from a corporate governance standpoint, is how we're managing that. And does the organization, are they taking control to try to centralize that decision making and the implementation? So one of the organizations I work with has created a task force. So everybody who has an interest in AI and implementation is bringing it to that task force. Not very many organizations, they're starting to do it more, but not everybody is doing that. And even though you do that centralization to try to manage it, because whether there's a conflict of interest, does the physician own the company that they're trying to, implement? Or is it really conflicting with another AI application that's being implemented, and really just trying to manage that? But even when you do have that centralized, I know that I've seen in some of the physician blogs about, hey, when you're working in the emergency room, you can go to ChatGPT and it'll create your documentation, your discharge summary when you give the information, basic, the prompts. So again, that's not a granted authority to do that, but providers are doing that independently. So realizing all the exposure, and not to mention intellectual property exposure, controlling that release of information. So making sure that you have communication and you have education to your staff and to your medical staff about how your organization will adopt AI.
Yeah, and then, bias, I think we could do an entire webinar on it. It's definitely a hot topic. I do think, though, that in reality, we should be talking about overall bias in healthcare. There's a huge disparity in the care that's given based on someone's race, someone's gender, someone's socioeconomic status. Bias in AI is a direct result of bias that humans have. The care provided to people of color, women, and especially women of color is inferior to the care that's offered to, say, a male who is not a minority. I think an example, in 2021, the maternal mortality rate for Black women was 69.9 deaths per 100,000 live births, which is 2.6 times the rate for non-Hispanic white women. Overall gender bias in healthcare harms women on multiple levels, and I don't think this is limited to just AI. If anyone's interested, I just actually read a book. It's called All in Her Head, and it focuses on gender bias in the healthcare industry overall. We can also look at the AI chatbot that Microsoft recently unveiled. Their name was Tay. Tay was a Twitter bot that the company said was an experiment in conversational understanding. So the more you chat with Tay, the smarter it gets. Unfortunately, after 24 hours, the chat bot went from playful and loving humans to racist and misogynistic. The data that Tay used to learn was from people's social media pages. It's definitely important that everyone remembers that AI by itself does not possess the ability to be biased or racist. These are attributes that are learned from us as humans. Another key factor in bias with AI is the overall data set. So with HIPAA regulations, the type of data that's collected, how it's collected, how it's stored, gives a lot of room for error and missing pieces that you really need for AI to truly be successful. So if you go to the doctor or dentist, urgent care, a clinic, a hospital, it's up to each patient what data they're going to give. And there's no checks and balances for it. So your race, gender, medical history, drug use, family history, it's up to each individual how much they're willing to divulge. And so I think that it's easier for AI to be pigeonholed as containing bias, when in actuality, I hate to say this, but bad data in, bad data out.
Yeah. And then, Linda, how is generative AI changing jobs? How are we seeing jobs change?
Sure. Yeah. I know we talked about at the beginning just this fear of people being replaced by artificial intelligence, but again, using it as a tool. So if we look at, it says here, 80% of jobs are likely to be affected by generative AI. Again, doesn't mean you're going to be replaced, but how you can use that tool to make your job more efficient and more accurate, more precise. So if you're looking at today and you have you have your expertise and then you have the transaction, they're thinking by 2027, you can see how much that changes on the right-hand column there about how the work will be augmented by AI3, which is another version, and then robotic process systems. So we'll see more robotic use in the future as well, and in particular for healthcare. But we still have to have that human element, for accuracy and for that empathy and for the human touch to try to continue to deliver healthcare in the most efficient method possible.
Great. And then looking at some of the types of liability in AI, Jennifer, what are you seeing? Can you talk about these types, that liability that we're seeing, and then also about insurance coverage that is available?
Yeah, the coverage is needed for standalone AI risk or a medical risk that is implementing AI into their overall practice. It doesn't really differ from the coverages that any med tech company needs. So we would want to look at the medical malpractice, tech, cyber, and then in some cases GL. Although premises liability is becoming less and less important as most of these companies are, they don't have a premises that they're operating in anymore. I think that the exposure and the coverage that really ties everything together is bodily injury. And it's traditional bodily injury from medical negligence that you're going to find under med mal. But there's also bodily injury from the tech aspect. And most of the companies that are operating in the AI world are tech companies, and they believe that they don't have an exposure for bodily injury because they never have before. They don't consider themselves medical professionals. They are tech professionals that just happen to be programming something for the medical field. Unfortunately, though, if there is a glitch, technology failure, poor programming, the AI algorithm learns things that it shouldn't, it could result in bodily injury, and then the coverage needs to exist there. A traditional tech policy rarely provides coverage for bodily injury, and if it does, it's typically not at the full limits. We have a huge exposure for cyber on here. The types of data that is being collected, you have PHI, you have PII, and it's all down to the worst protection on your system as to, and it's usually going to be somebody clicks through on an ad and there's some sort of ransomware. But there's also a bodily injury component there too. I think we just recently saw Lehigh Valley Hospital had a ransomware attack, and they did not pay the ransom, and the hackers ended up releasing pictures of women going through breast cancer treatments. So, we are actually seeing cases now where a cyber incident can lead to a bodily injury claim. AI is also unique in that it has an aggregation exposure, and that's not something that we typically see with a traditional med mal risk. If we're talking about a dermatologist or a neurologist and there is a misdiagnosis or an incorrect diagnosis, it's usually only applied to one patient. But if the AI bot learns something incorrectly, or it's coded wrong, or there's some sort of glitch, the error can affect large populations rather than a single patient. So with AI, I think we can expect to see severity, but also definitely frequency with this class.
Okay. Linda, did you have anything to add?
I do want to add too, about the discussion about AI personhood too.
Mhm.
So, really saying, does that AI chatbot or whatever have their own exposure? And interesting, there was a case that we kind of went around our office this past week where a guy was using the chat box with Air Canada and got some incorrect information. And so he sued, Air Canada for that. And the courts and the defense was the AI piece is a separate person and they're not part of Air Canada, which they were not successful in making that argument. But to really say that you're going to lose that connection from an agency standpoint, to have AI have its own personhood, but there is that potential risk in the future.
Great. And then looking at the implications of health liability, Linda, did you want to go over this?
Sure. Yeah. So as we talked before about the different, allegations from a medical malpractice standpoint, you have, failing to relying on the AI without doing your own evaluation. Again, that's an area that, physician cannot necessarily absolve themselves from. Do they have proper, implementation practices? Is there some type of vicarious exposure, again, from the standpoint of following an error made by the AI system? So there is that medical malpractice exposure, as I mentioned before, the product liability exposure. So again, that's why we're really suggesting that hospitals and physician groups or anyone else who's implementing really have a process in place to vet it as much as possible and have those systems in place from an education standpoint on reliance on it, to make sure that you have those secondarily reviews to make sure there is accuracy and communication properly to the patient.
And then looking ahead, that there's obviously with regulatory, there's a lot of controversy on how AI can be regulated in healthcare and how it might not be enough, as well as, who's managing it, who's monitoring it. And so it is a bit of an unsettled landscape. And you've got the regulatory oversight from the Biden-Harris administration, which showing here on the slide, which includes President Biden's executive order, issuing key disclosure requirements for developers, risk assessments, and more. There is a link to the bottom, so when we share these slides, you can click on that link if you haven't seen the fact sheet that goes through everything in particular. So that's kind of one part of regulatory. Then there's the AI Bill of Rights. Jennifer, did you want to go through in some detail about the Bill of Rights and its overall purpose?
Yeah, absolutely. So the AI Bill of Rights, as you can see on the slide, it's a set of guidelines that the White House has developed for the responsible use of artificial intelligence. And there are 5 principles to it. So the first is safe and effective systems. And that is ensuring that AI systems are reliable, secure, and that they don't harm individuals or society as a whole. There's algorithmic discrimination protections, that's a mouthful, which is preventing bias, discrimination, and inequities in AI decision-making. There's data and privacy, and that one touches on safeguarding individuals' privacy and preventing unauthorized data collection. There's notice and explanation, which is to provide transparency and clear explanations for AI-driven decisions. And then the final one is human alternatives, which is to ensure that people have meaningful alternatives to AI. So really the AI Bill of Rights is supposed to be a guide to the responsible development and deployment of AI. While this exists, it's not currently being used in practice or in sort of regulations. The regulatory part of AI is a bit of a mess right now. There's a couple of industries that move quite slowly. One of them is the government and another is healthcare. And so trying to adopt this new technology and create regulations and legislation, on a minute by minute basis almost, I guess it'll be interesting to see how it goes. The FDA has actually, by October of 2023, had approved 592 medical devices that included some form of an AI algorithm. So there are different parts of the government that are, I guess, a little bit further along and are creating new systems to monitor and regulate AI, but I don't think that we're there yet.
Yeah, a couple other, just to go through the slides that we have. There's, the World Health Organization's stance on AI in healthcare, and the U.S. regulatory oversight. So you've got, by the FDA, the Office for Civil Rights, the Federal Trade Commission, the ONC, and the Centers for Medicare and Medicaid Services. You noted on some of these slides, in the particulars in terms of their oversight. And the goal for the Coalition for Health AI is to, develop the guidelines and quadrails to drive high quality healthcare. And they're doing that by, promoting adoption of credible, fair, and transparent health AI systems. And then this next slide, you can see here, obviously, all of the partners and U.S. federal observers. You've got, Google and Microsoft in there.
Yeah.
So Jennifer and Linda, is there anything else you'd like to add, comment regarding, regulation and monitoring as it currently stands?
Sure. Yeah, I just want to add too on this CHAI partners. There is, recently Google and Microsoft joined this group. The idea is that they will be giving kind of a, good housekeeping seal of approval, if you will, that they will be, red teaming, really challenging the security of these systems. What we can try to do to make sure that they're tested, that you're addressing bias, that you're looking at protection from hacking, that you're looking at to see the potential for misuse. And even the example that Jennifer gave about how when people started going in, how the whole flavor can change just by people's response, and the machine learning from there. So again, there's efforts being made. Some are it's quite controversial. People think that some people think there's not enough being done, and other ones are thinking there's no way you can control this. So the whole world is going through this at the same time. The EU AI Act is also expected to be signed by the EU Parliament April 1st. So as the EU is addressing it and the US is addressing it, and big tech is also addressing it, but they're also playing in that field too. So are they monitoring themselves? Is the concern. So it is an area that everybody is concerned about, but from a liability standpoint, that's why we're really recommending that you have those governance processes in place as your organization adopts various AI practices.
Great. And then, so Jennifer, how is insurance responding to AI?
Sure. So I did look at any sort of case studies that were out there, any case law that was focused on AI. And so we have this slide here, which is a scenario. And I think the slides will be distributed after this because it may be slightly difficult to read. There's a lot of words here, but I think it's good information. So the scenario is a malicious malware infiltrates a lab samples AI tool. And this really goes over what stakeholders would be affected, potential triggers, and then potential coverages. And we actually have a couple other case studies that we could distribute after this, but I thought it was interesting when we look at the applicable stakeholders who would be affected in this scenario, and it's really everyone. It's everyone in the chain. It's not just the user or the patient, it's the user, the doctor, the hospital, the developer, and it's like that for every single scenario where we're looking at generative AI being part of healthcare. And then On the next one, next slide is the current legal landscape. What I thought was interesting is that there are actually 3 very large class action lawsuits happening right now. And it is 100% focused on AI, and it's AI for benefit determination with large health insurers. So right now, Humana, Cigna, and United Healthcare have separate class action lawsuits from consumers and their estates. And what they are claiming is that AI is denying claims and denying benefits for people who are have a like an end of life illness or a chronic illness. Basically, they're using AI to determine the likelihood of survival versus the cost that it would have to care for the patient, and then denying claims or coverages based on their findings. And this has happened. I mean, it's terribly focused on skilled nursing facilities and rehab centers, places that should be covered under Medicare Advantage plans. But basically, the gist of it is that these 3 health insurers have been using AI to deny claims in situations where the cost of care is outweighed by the longevity of life that a patient would see. And these are very early on, but I think that this is a good indicator, sort of a temperature check of when we're implementing AI into the administrative part, and we're forgetting things that humans are good at, like empathy and critical thinking. So we have these situations where many hundreds of claims have been denied. Care has been denied to patients who AI determined that the cost to keep them alive was too great.
Okay. Linda, anything you wanted to add?
No, it's just those are just the beginning, and I think we're going to see many more cases in the future when you're going to, whether it's administrative practices like that, or some implementation of more of the clinical applications for using AI to diagnose or to make treatment decisions.
And just looking at this last slide here, there's the 4 key strategies for successfully harnessing the power of AI. It starts with why, then responsible use, accountability, and transparency. Jennifer and Linda, in closing, what is your outlook of AI in healthcare, and what do you see as the biggest hurdle or hurdles?
I mean, I would say that I'm excited. I think that implementing AI into healthcare will have better clinical outcomes. I think it will help to prevent or at least assist with clinician burnout and the staffing shortages that we're facing in the healthcare industry. I think that AI is an amazing tool, and it gets people away from sort of using their gut to make decisions on, healthcare related items or insurance for that matter. It's just like a feeling. I've heard that, many times throughout my career. But it uses data, and it can make assumptions based on huge data sets. And I think it's going to be important. And honestly, it's something that we really need to embrace because I feel like it's not going anywhere.
Yeah, I agree too. And I think, part of that adoption, whether that is generational, people, let's say you have that automated phone system that's trying to ask you questions to get you to the right department. We've all had those experiences, and sometimes you just want to opt out. So there could be that frustration. So if somebody needs something, do they have the ability to get around the processes, or as the example was of the denial of claims, to say this doesn't make sense? And then you're going to see significant litigation, I think, in those areas. So there's going to be that frustration of adoption. I'm excited about it as well, because I think there's a lot of opportunities as we face, fewer workers as the baby boomers age, out further out of the workforce. But we're going to see the for instance, nurses. If you look at how much of their time is spent on administrative duties, that could be streamlined in some way by using AI. It's really going to make that process more efficient and really having that hands-on care to patients that are so important. So I think there's good things that'll come out of it from a patient acceptance, but there will be frustrating areas as well.
Great. Thank you both. Now, we did want to go into a couple of questions. There were a couple questions submitted during the registration process. So the first one is, what is your concern that would be the worst case scenario blending in AI with healthcare? Does one of you want to take that?
Yeah, mine is the aggregation issues, where it's, one size fits all. I think when you're using an algorithm and applying it to a large population, if something goes wrong, it's going to go very, very wrong, rather than, the system that we have now where it would affect only an individual patient.
And the delay, that may not be evident even in that scenario we have. It could be years down the road. It could be even exceeding statute of limitations, where those batch claims, you're realizing that a number of people had a false diagnosis if there was some type of reading of a pathology slide in that example. And again, people will start to rely on it, and we need to make sure that they can't use that instead of. So that's part of the adoption and the concern of a bias or the batch in the long-term harm that could be done. And not to mention the cyber aspect of it.
Yeah. And the second question is, what are HIPAA concerns with using vendors? And then I also saw, just in part of the comment from Dr. Michael Connerly, there was a note about how providers can use the tools.
So from a HIPAA standpoint, from your vendors, I mean, they should have, business associate agreements, but also in tying it in with Dr. Connerly's question, as I mentioned, residents or physicians entering data into ChatGPT to write their note. I've used it myself personally to write letters to people, and it makes it so much easier and so much quicker, but you cannot enter patient identifiable information in there. I know people that are uploading their resumes in it. For instance, many employers are using the applicant tracking systems now that will screen your resume and will weed you out just by an AI tool. So, if you're uploading any information into any type of ChatGPT type or GPT type tool, there is that potential for a breach in patient confidentiality. So that's why I really think by centralizing these decisions and having the organization consider all the risks, the enterprise risks of adopting various AI tools is so important. And whether that is a physician group, senior care, outpatient, managed care, whatever it is, those risks have to be considered, in particular with patient privacy.
And then another question was more of a scenario, a physician using a medical piece of equipment provided by the facility in which they're providing care or diagnosing a patient, and the equipment has an AI element built into it, approved by the FDA, and based on the information action provided by the equipment, there's an error causing patient harm. Would the entity's policy cover the claim? Would the physician's policy cover the claim?
I think the answer to that is yes. I feel like in that scenario, the claim is going to be brought against everyone. And there's going to be negligence with the AI or the device in that it didn't work properly or it drew the wrong conclusions. But there's also has to be oversight of the AI. And so, the final call is made by a human. And so the negligence is probably going to also fall on the doctor. I don't know that there's many cases right now where the medical device failed and both the doctor or the facility and the manufacturer of the medical device weren't brought in. And I don't think it's going to be any different with AI, although it hasn't been tested yet. There isn't case law specifically for AI But there's plenty of case law when we're looking at use of medical devices within a facility.
And that is, I'll just note, that is one session topic at the conference in April, is when a medical device goes awry. So I'm sure that'd be it for whoever had that question. That would be a good session to go to. A couple other sessions on clinical technologies as well. One question, an additional one that came in, if you guys can answer this one in some way: are medical malpractice claims expected to increase or decrease with the use of AI?
I haven't seen any studies that are making any prediction with that. So if you think about the potential for these larger batch losses, if there is a bias or an incorrect assumption that's made, then that is going to increase, and you're going to have those big, mega tort cases that make plaintiffs' firms hundreds of millions of dollars. So there is that potential, but I have not seen any studies that's making any prediction as to what's going to happen.
All right. Well, that's all that we had for today. Thank you, Jennifer and Linda, and thank you to everyone for joining our Crittenden Medical Liability Conference virtual event. We do look forward to seeing you April 8th through 10th in Charleston, South Carolina, and do be sure to visit crittendenmedical.com to check the conference agenda. I hope everybody has a great rest of your day. Thank you.
Thanks, Michelle.
Thanks, Michelle.
Bye.